Hey everyone, Dr. Eric here from MedBetter Health, where we talk all things dementia and we help caregivers like you get the information that you need. So, you ready? Let's go. One of the questions I get asked all the time is, what is sundowning and what can we do to prevent it? So, first of all, sundowning, think about it this way. You have grandma, and in the late afternoon to the evening, all of a sudden, grandma gets confused. I'm not talking about just one day. I'm talking about it's like a pattern, right? And then not only does she get confused, but she also has these behavioral changes, anxiety, agitation, aggression, right? And it always happens when the sun goes down, sundowning, right? So why don't we talk about this for a second? What are you going to recognize? How do you know? So it's going to be late afternoon or evening. And you're going to notice that grandma or any other person living with dementia, they have these common three things. Number one is physical restlessness. They're pacing. They're wandering, right? Their inability to settle. Okay. Then they may have this emotional escalation where all of a sudden they were fine, but now they're getting anxious. They're getting agitated. They have this aggression that happens. And the third component is the cognitive disconnection, confusion, disorientation, ignoring directions, right? So this is a very important slide. It talks about the core biologic triggers. So we have something called circadian rhythm, right? Our circadian rhythm, that's like our internal clock. When is it morning? When is it nighttime? When do we go to sleep, right? And what's interesting to notice is that if we have abnormalities and instability, meaning variability, right? It's all over the place. When we go to sleep, when we wake up, especially in persons living with dementia, and that starts to go down, and obviously throughout the day, what happens to all of us? We have accumulating fatigue. We have increased sensory input. And look what happens. The more the circadian rhythm stability goes down, the more we have sensory input, and it's towards the late afternoon, here's the sun, that's the point where you have the most vulnerability. That's the vulnerability zone. So now we've identified the problem, but let's take a look and say, okay, right, and look, this is very important. As the internal clock fails to distinguish the day from night, the overstimulated brain struggles to wind down because it's not winding down, it has no routine, and what does it trigger? It triggers restlessness. Okay, so take a look over here, right? The environmental catalyst, light. Light is actually a big deal. We don't, oh, it's just light. No, 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 no. Right? Think about the back in the days, right? We didn't have all this artificial light. The circadian rhythm was regulated by when the sun went up, the sun went down, the moon came up. That's it. Now we've got computer screens, now we've got TVs, right? Now we've got lighting in the home, all these different things. Light is actually the environmental catalyst. So you have daylight and then you have transition to darkness. And if you look over here, daylight, reliance on daylight for orientation and comfort. What does that mean? So in order to combat sundowning, one of the things is routine. So let's say mom is sleeping in her room, and every morning you have a routine. At 7 a.m., you walk into her room, and her blinds should always be closed from the outside light, because outside light comes in, it's confusing, again, to someone living with dementia. It can also trigger some shadows that she'll see, and she'll think it's ghost or another person in the room. So you close the shades at night. You walk in the morning, you have a routine, and what do? You take these blinds over here and you open them up. The sun comes in every morning as a routine at a specific time at 7 a.m., 8 a.m., right? I'm not giving you a specific time, but you get it. You have to have a specific routine. So mom now understands, wow, the sun's coming in. Her circadian rhythm gets stimulated to understand that it's time to wake up, right? Same thing at nighttime, transition to darkness. Diminished light creates deep shadows. For a brain with dementia, these shadows trigger severe confusion, frightening hallucination, and agitation. So when you have these shadows, you see at night, the curtains are open and you've got these different shadows coming in. For you and I, maybe we can process that okay. But for someone living with dementia, they actually look at it as severe confusion, frightening, hallucination. It frightens them. Now, we're going to continue, but you're a caregiver. You're thinking, wow, this information is incredible. Why didn't my doctor tell me about this, right? Because Medicare now realized, well, doctors, and I'm a physician, in the office, you have 20, 30 patients you're seeing. You don't have the time to sit down and actually go through this. You're thinking about hypertension, diabetes, dementia. So Medicare came out with a program that we are participating in. We're taking the lead in this, called the Guide Model. And it's specifically to help you, the caregiver, to educate you like this, and also to provide you resources, even resources like having someone in your home take care of mom, and Medicare would pay for it while you can catch a break. And you can have your own care navigator that you call and you ask these specific questions. So in the end of the video, we're going to have a link that you can click on to see if you qualify. And if you have if mom has traditional Medicare and a dementia diagnosis, she qualifies. So definitely recommend you check that out. But let's go on. So the transition from light to darkness is not just an indicator of time. It's a sensory disruption that exacerbates anxiety. What other things can trigger? What other things can cause, the sundowning? Well, number one, medications. If there's any medications that interfere with sleep, that could be it. Coffee late at night, caffeine, can interrupt the circadian rhythm, especially in a patient living with dementia. So you want to use decaffeinated things. Psychological factors like intensifying under anxiety or depression. Unmet physical needs, whether it's hidden pain or whether it's bodily discomfort, right? And this is a huge one. That's external. Changes in routine. What you want to do to optimize the sundowning, to make it go away, is you want to establish a strict routine so that the circadian rhythm for mom could be responding to that routine and not confused and not agitated, right? So moving to a new environment, for example, can trigger a nighttime disorientation, a new room, all right? Staffing transitions, when you have a new home health aide or a new person who's taking care of mom, that could trigger the sundowning as well. So what do? We talked about this. Lighting. I cannot overemphasize lighting. Use soft, even lighting to eliminate shadows. Very important. You got to walk into the room at night and see, are there any shadows? Because that will trigger sundowning. You want to have windows and mirrors. You want to close the curtains. I can't stress this enough. At nighttime, you want to close the curtains. Super important. You want to have specific lighting on the floor that when mom puts her foot down, there's a light that comes up so when she goes to the bathroom, she doesn't trip and fall. But ultimately, you want to have these soft lights. You want to close the curtains, cover the windows so there's no reflections when it gets dark. Then you want to have an atmosphere of familiar objects. With a circadian rhythm training, imagine every night at 8:30 p.m. on the dot, mom is taken to her room. 15 minutes, you have Alexa with a timer playing her most favorite soft music, very soft, not loud, low. And mom's brain knows every time she hears this music, she's in bed. It's quieter around. Your kids are not blasting loud music. No one's watching TV. It's dark, the curtains are covered, and it's 8 o'clock every day at the same time. Now her brain will start to rewire and her circadian rhythm will start to be stable. That's so important. You're going to call your doctor and they're going to say, here, give her a sleeping pill. Give her this, give her that. This thing takes 30 to 60 days to set up, meaning you have to be consistent with it, but you don't have to give mom meds if you do it right. And that's what we teach you here at the Guide Model. Right? And that's why I feel so passionate about this program, and you should reach out to make sure that you get the support that you deserve and need. All right. Minimize background noise to prevent overstimulation. So in summary, routine is super important. Having the same routine. Sunlight we talked about is very important. At nighttime, covering the shades and the curtains. We also talked about routine, and a winding down procedure where as you're going towards the night, we're winding down and mom knows, oh, I'm always in my room at a certain time. There's a specific song, there's a specific routine that I go through, there's light, everything's quiet, and she goes to sleep. And you avoid unnecessary medications, right? Your unnecessary things that will harm mom. So, if you found this video useful, subscribe, comment below if you have any questions. We actually respond. And if you're interested in having the support like this, except not just via video, but actually having a care navigator who you can talk to. Imagine talking to a Dr. Eric or a care navigator and asking these questions and having them help you walk through all this, and it all being covered by Medicare. And there's so much more. Imagine having someone in your home that if you are exhausted and you are thinking, look, let me actually have someone else sit with mom for 4 to 8 hours while I go and just decompress a bit. And who can pay for that? I can't afford that. Oh, Medicare can pay for that. If you're interested, there's a link that you'll see over here. Go to that link. There's going to be a video talking about the new program called the Guide Model. Then there's going to be a questionnaire just with a few questions that you can answer to see if you qualify. And if you do qualify, we'll reach back out to you and we'll get you started. Again, I'm Dr. Eric from MedBetter Health, and I'll see you soon.